No, I don't have much to say anymore. Briefly do it.
Wannan PowerPoint ɗin da objectives ana haɗa.
Hi, good afternoon, everyone. You are welcome to the second session, where we are going to discuss on fluoride deficiency and fluorosis. Just for clarity, the deficiency aspect has to do with the lower concentration of fluoride, maybe below the recommended allowance. And then in the case of fluorosis is when we have high concentration of fluoride intake. And chlorine, unlike in other ones, although even in the case of iron, we talk about, or we just mention hematochromatosis, and that is iron overload, and iron overload has been attributed to quite a number of disease condition, inflammation, etc. So we see fluorosis and how is fluorosis have or enforce some negative effects. Okay, fluoride is a fluorine, which is an essential element found in bones and tissue. So when taken, usually in drinking water as the main source of fluorine, it is absorbed by the intestine and then taken to these calcified tissues, which are bones and teeth, and then deposited, while the remaining will be excreted out in the urine. And the recommended dietary allowance is 1 part per million per day. That is 1 milligram per liter per day. When you take excess of it, it will be excreted, but you know that it is deposited. So taking excess also will mean excess deposition in those tissues, and it has its own negative effects. So before we talk about the function of fluoride, what is the function of this fluoride in our system? When taken, it is involved during the deposition on the teeth. It helps in the development, and also it prevents dental caries. We talk about dental caries. What is dental caries? And how does fluorine or deposition of fluorine on the teeth prevent dental caries? Second, fluoride is necessary for the proper development of bones. See how fluoride facilitates the deposition of calcium and phosphate on the bone, and this increase the density of the bone. And how does that improve or prevents osteoporosis, and how excess of it causes skeletal fluorosis? What is the skeletal fluorosis? And we also know that sodium fluoride or fluoroacetates can also inhibit some enzymes like glycolytic enzyme analase or citric acid cycle aconitex. And how does this even also help or related to the prevention of dental caries? Okay, fluorine deficiency and excess. Just like we mentioned, the recommended intake is 1 part per million per day. So taking lower than this, because of the role it's play, taking lower than 1 part per million, for example, less than 0.5 part per million can lead to dental caries. So deficiency of fluorine lead to dental caries. We'll talk about the dental caries. But when you have more than 1 part per million, there is a tendency of developing fluorosis. So fluorosis has to do with the excess intake of fluorine. Excess intake of fluorine can lead to either dental fluorosis or skeletal fluorosis. So in either case, we talked about each the severity and the duration of these symptoms depend on the age, nutrition status, environment, kidney function, because we talk about the digestion, excretion being excreted by the urine, the amounts ingested, the genetic background, and the tendency to react. So dental caries. So in the case of dental caries, when you have or you are taking water that contain water or any other source, but majorly water is the main source of chlorine. So when you're taking the drinking water containing less than 0.5 part per million, and this can lead to dental caries. What do we know is that in the feet and fissures of premolar and molar, that's teeth, we have this bacterial fermentation of the residual foods. And once the bacteria ferments, it produces some acids. And this acid can actually remove or washed with part of enamel and dentine. And this leads to the exposure of pulp. That is the base of the teeth there, and that leads to inflammation and causing toothache, tooth decay. This typically what is referred to caries, as you can see from the picture. So this fermentation leads to inflammation and the decay of the teeth. How does fluoride help in preventing this? Because what basically happens is the acid facilitate in the removing of this layer of enamel. And the layer is majorly made up of this hydroxyapatite. So hydroxyapatite, in the presence of fluorine, hydroxyapatite can react with fluorine to form fluoroapatite. And these fluoroapatites form a kind of protective layer on the surface of enamel, thereby preventing this acid from removing the enamel layer and causing the damage. So this is how the prevention takes place. And we talk about inhibition of aconitase and inhibition of enolase. So because of course, these organisms are carried out, even though anaerobic, but to some extent the aerobic process, like in the breakdown of glucose, where aconitase is inhibited. So the bacteria, of course, will definitely be affected in terms of energy production. Even though in the case of aconitase, we talk about anaerobic process. So dental fluorosis. What happened in the case of dental fluorosis? In dental fluorosis, we have when you take a water more than the 1 part per million, usually from 3 to 5. Some literatures will tell you more than that. You will have a kind of mottling and the discoloration of enamel. And this mottling and discoloration can lead to corrosion, stratification, formation of even pits, and this lead to a range of symptoms from tiny white streaks to dark brown strain and raw pitted enamel. And this weaken the teeth, thereby making the teeth look rough and losing that glaring and luster that usually occur in children before the completion of teeth mineralization. From the picture, you can see different stages where you have a normal teeth, you will have a questionable where some trace of this can be seen. In very mild, you can see some little yellow which is not well identifiable. In a mild, you will see it. In a moderate, and in severe, you will see little dark brown. They are related to pleurosis. And while in the case of skeletal pleurosis, you will have, when you have the concentration high up to about 15 to 20 milligram per liter, and that can lead to, because normally the small amount of it ingested in food and water can promote the development of bones, just like we earlier explained. But how does it do that? It increases the retention of calcium and phosphate, thereby increasing the density of the bone and preventing even old age osteoporosis. But in high intake, you have a situation whereby the increase in the fluoride content would stimulate osteoblast activity and cause abnormal increase in calcium and increase in the density of the bone. This clinical manifestation is called genubulgum knockness. It is related to increase frequency of fracture because the bone become hard and